Hello everyone, welcome back to UWorld's Next Gen NCLEX Review. My name is Nicole here with another question drill set. If you are new here, welcome in, glad to have you. If you're just stumbling on by, well hello to you too. We are going to do a question drill set over cardiac questions. So these are all things heart related, whether it's medications, different syndromes or different disease processes, complications versus expected findings, everything cardiac related. So it's a lot of meaty information, a lot of learning opportunities. So we're going to go through this together. How a question drill set works is I will pull up a question right above me, give you about 30 seconds to review it, mull over the answer choices, try to figure out the key words in the question that kind of helps steer you to the right answer, and maybe even drop your answers in the chat because I like to talk to you guys and have a little discussion there. So then I go over why the right answers are right and the wrong answers are wrong, and go over the rationale between each one. So without further ado, let's get started. Oh, like I should have said before, we have Nurse Samantha in the chat moderating for me. Don't look at the answer. Moderating for me today. So if you have any questions, she is there to help you guys. And then, yeah, let's get started. I hope I didn't spoil this first one for you guys. I hope I was quick enough to take out the answer. But let's go over it. The nurse is caring for assigned clients. The nurse should first assess the client who has what? Option 1, chronic obstructive pulmonary disease, a pulse oximetry reading of 91% on room air, and reports a chronic cough. Option 2, atrial fibrillation, an elevated heart rate, and reports occasional fluttering feeling in the chest. Option 3, fibromyalgia, fatigue, and reports generalized pain rated as 7 on a scale of 0 to 10. Or option 4, heart failure, edema of the lower extremities, and reports dyspnea. Let me know what you guys are thinking in the chat. Hello, hello, everyone. Someone is asking me how old I am. You never ask a woman their age. But I've been a nurse for, this year is my 10th year anniversary of being a nurse. Crazy. Time flies when you're having fun. Good answer choices. Good job, guys. Pretty unanimous in the chat, whether you knew it off the hand or whether you already snuck and saw my answer. Sorry about that. But it is option 4, that heart failure, edema of the lower extremities, and reports dyspnea. So assessing the client first, meaning we're looking for priority actions, looking for things that are complications rather than expected findings that could increase and have some alterations with our ABCs. So airway, breathing, and circulation. So option 4, heart failure, edema of the lower extremities, reports dyspnea. Heart failure is a progressive condition characterized by impaired ventricular function that leads to decreased cardiac output and inadequate tissue perfusion. So as that blood backs up into the lungs and out of this systemic circulation, it can cause fluid overload in the lungs and cause that shortness of breath. So this is a complication, not an expected finding. We never want to get to that point. So we need to intervene in this case because that shortness of breath is indicating that we're having fluid overload onto the lungs, which means that heart failure is getting worse. All the other options, options 1, 2, and 3, are all expected findings and symptoms with the disease process. So option 1, that chronic obstructive pulmonary disease, or COPD, with a pulse oximetry reading of 91% on room air. This is an expected finding. They have a decrease oxygen exchange, and because of that chronic obstructive pulmonary disease, that COPD, not allowing them to have that full expansion of the lung. So they actually operate with a lower oxygen saturation, so that 91% is okay. Option 2, atrial fibrillation, an elevated heart rate, and reports occasional fluttering feeling in the chest. Expected finding, that occasional fluttering feeling is that AFib that they are feeling, that fluttering of the heart or the atrium quivering. So that's an expected finding with atrial fibrillation. As long as they're paired together, then it's an expected finding. And then option 3, the fibromyalgia, fatigue, and generalized pain. Again, an expected finding and expected symptoms of fibromyalgia. So it is okay, but good job, guys. Someone said that was so simple. Well, let's try this one. The nurse is assessing a client who had coronary artery bypass graft surgery 1 day ago and notes muffled heart sounds on auscultation. Which of the following actions should the nurse take? Option 1, administer IV furosemide. Option 2, notify the healthcare provider. Option 3, place the client in the semi-Fowler position. Or option 4, document the finding in the client's electronic medical record. Let me know what you guys think in the chat. Also, let me know if we have any recent NCLEX passers or schedulers, or now I'm even going to throw in anyone waiting on their ATT, because that seems to be a lot of people as well. That patience is a virtue, waiting in that limbo period. You graduated, you're waiting for the school to do their job by sending that ATT, so now you can test. So let me know. Oh, Kayla passed yesterday. Congratulations, Kayla. Welcome to the RN life. Let's see who else. Someone says they're waiting. I see another one saying they're waiting for the ATT. Yes, that ATT, that golden ticket. Evelyn is scheduled for the end of this month. Good luck to you. You're going to do great. Someone's waiting for the ATT. So Carter is taking their test in October. Lexi's taking their test tomorrow. Good luck to you guys. Waiting on the ATT. I'm glad I threw in waiting on the ATT because a lot of people are waiting on the ATT. Sabrine taking theirs on Tuesday. Good luck to you. Sandy taking hers on September 20th. One last semester to go and a lot more ATT. Someone is asking what ATT is. It's basically the certificate that you finished a nursing program and that you're ready to take the NCLEX. It's kind of like a golden pass number ticket to take the NCLEX. But okay, correct answer for this one is option 2, notify the healthcare provider. So our client had a coronary artery bypass graft or a CABG 1 day ago. So we are doing close monitoring because there can be some severe and quickly forming complications that can happen. So those muffled heart sounds on auscultation, this is indicative of a cardiac tamponade, which is life-threatening and requires immediate intervention. So that's when fluid builds up around the heart, so in that pericardial sac. And as that fluid builds up, it kind of hinders the heart from pushing blood forward and actually contracting well. So then you have decreased cardiac output, and we know with that decreased cardiac output, you can have lots of problems, also known as death. So we need to do quick interventions, which would be a pericardiocentesis, which is only something that the doctor can do. So we need to notify the healthcare provider immediately. This is an immediate action, immediate, like life-threatening, lethal intervention. So notify them immediately. Options 1, 3, and 4 are all things, yes, that we probably would be doing, but we need to notify the provider so we can have some interventions actually happen ASAP. So administer IV furosemide. This is something that they would probably do later to kind of decrease that fluid and prevent it from building up again, but that's not going to be that immediate quick acting intervention. So we can hold off on that one. Option 3, place the client in the semi-Fowler position. This will kind of help take off the demand of demand on the heart, so then it can be a little bit better. It's a comfort measure, but not like immediate action, life-saving action. And then option 4, document the finding in the client's electronic medical record. Yes, we're always going to document, but it's not going to be that intervention that saves the client's lives. So for questions like these, I like to think if I can only do one thing that could potentially save the client's life almost immediately, notifying the healthcare provider in this case would be that immediate action. They will get to this ASAP. This would be more of a, I would say even higher than like a rapid response. So good job, guys. Question number 3, the nurse is teaching a client with newly diagnosed hypertension. Which of the following information should the nurse include? Select all that apply. Option 1, consider participating in a smoking cessation program. Option 2, practice stress management techniques. True stuff. Option 3, engage in moderate exercise every day. Option 4, consume a low fiber diet. Or option 5, check your blood pressure before taking metoprolol. Let me know what you guys think in the chat, and we'll go from there. Good job, guys. Someone said, what should a regular heart sound like? It should sound like the normal lub-dub, lub-dub. It shouldn't be hard to hear. It should be just very loud and strong heart sounds. You shouldn't hear muffling or distant heart sounds. Those are all very concerning. Good job, guys. Lots of correct answers. Just a little shout out and plug. Since school's back in session, that also means conference season is coming up. So if you are getting ready to go to conference, or if you don't know about conferences coming up, please get in the know with your school's association. We have NSNA in Columbus, Ohio. We have the Florida one in Orlando coming up, CNSA in San Diego, SNAP in Pennsylvania. We'll all be at those conferences. So if you see us there, come say hi. We love to see our students in person, and just give a little shout out maybe later on. But yeah, also I see someone saying they're going to SNAP. Hope to see you guys there. Anyways, correct answer for this one is everything except option 4. So when talking about hypertension and teaching, there's a lot of things that go hand in hand, but the main thing is we want to have good lifestyle modifications and a healthy diet. So lifestyle modification, smoking cessation program. This is one of those things on the NCLEX that if they ask about stopping smoking, that will always probably be a right answer. Stop smoking is a #1 true tale. It will never be a wrong answer. So that is correct. Option 2, practice stress management techniques. Yes, this is correct. With that stress management, we're having less constriction on our arteries and stuff, so that can lower our blood pressure. Option 3, engage in moderate exercise every day. Again, this is working that heart contractility and working that heart muscle. So if you have stronger muscles, then it doesn't have to work as hard and you can lower the blood pressure. Same with option 5, check your blood pressure before taking metoprolol. Metoprolol is a blood pressure medication to lower your blood pressure. So this is a good teaching habit to check it before, so you're not causing hypotension. So all of these are correct answers. The reason option 4 is incorrect because we actually want to consume a high fiber diet, because high fiber can reduce your cholesterol, and cholesterol also hinders that plaque in your arteries and causes hypertension and other problems. So if we can have a high fiber diet, we're going to have lower cholesterol and it'll be all good. So high fiber, not low fiber. But you did good. Question number 4, the nurse is preparing to administer digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? So this is this is an analyzing type of question. What do you know about digoxin and what it can do for you? Option 1, heart rate of 56 per minute, 56 beats per minute. Option 2, temperature of 99.1. Option 3, respiratory rate of 22 beats per minute, or option 4, blood pressure of 115/75. Let me know what you guys think. And I'm seeing great rationales. Love to see it. Good job, guys. Good job. This one seems pretty unanimous and everyone is getting it right. So I don't think I'll have to hold or stay on this answer choice for too long, because I don't think I see one wrong answer. Good job, guys, which is option 1, that heart rate of 56 beats per minute. This is a very, how would I say it, a big indicator of something that we should not do, mixing digoxin with an already low heart rate. I feel like nowadays they even include it on your electronic medical record as you're administering it. It's like, what is the client's heart rate before you give this medication? Because we want to make sure that there is a kind of a safeguard before administering this medication. So digoxin is a cardiac glycoside, and it's usually given to clients with heart failure. It's a medication that kind of helps with the heart contractility. So it makes your heart beat faster and stronger, or not faster, makes your heart beat stronger, which sometimes makes your heart beat a little bit slower. So it can sometimes decrease your heart rate. So if you already have a lower heart rate and we give this digoxin, that's only going to further decrease your heart rate even more. So we always want to administer and make sure that the heart rate is above 60 beats per minute, which is the low parameter of our normal heart rate. All the other options don't really have a factor when it comes to digoxin. A temperature of 99.1, this is still technically low, or not low. It's lower than a temper or fever, so you can still give it. We usually don't treat temperatures unless it's like above 100.1, so this one doesn't even matter. Option 2, respiratory rate of 22 beats per minute. This is a little bit on the higher side, and it actually could improve once we give the digoxin. Since the heart is beating stronger, then it puts a better cardiac output, which means that you're getting blood to the lungs, which will make you breathe a little bit slower. So that would actually work in its favor, but it's not the direct reason why we give digoxin. And then option 4, blood pressure reading of 115/75. This is a normal blood pressure, and digoxin actually doesn't have a factor into your blood pressure. So good job, guys. Y'all did very good. Next question. The nurse has taught a client about the prevention of deep venous thrombosis, a DVT. Which of the following statements by the client would require follow-up? Option 1, I am not at risk for developing a new DVT because I've had a DVT in the past. Option 2, I will plan rest stops during long car rides to get out of the car and walk around. Option 3, I should wear compression stockings on days when I'm working long hours. Or option 4, I will notify my healthcare provider if one of my legs looks larger than the other. Let me know what you guys think in the chat. Someone says, also check the apical pulse. This is 100% true, because sometimes what you see on the monitor is not exactly what is actually happening with the client. Good job, guys. And since we're halfway through, I can ask my favorite question of the day, which is, where are you guys tuning in from? I love to see how far UWorld reaches in the world. So whether you're domestic or international on this lovely Thursday afternoon, let me know where you guys are watching from. First one I see is Las Vegas, New York, Texas. Ooh, those are quick. Orlando, Maine. I hope to see you in Orlando. Ghana, New York, Oklahoma, Miami, Maryland, Philippines, Ontario, Canada, Saudi Arabia, Ohio, Louisiana, UK, Nigeria, Kenya, Texas, Zambia, Uganda, Fresno. It's so fast. Liverpool. That's my brother-in-law's favorite soccer team. Philippines, Chicago, St. Vincent, St. Kitts, India, Minnesota, Pakistan, San Diego, Ghana, Florida, getting pinned next week. Congratulations to you. Colombia, San Francisco, New York, Miami, Canada, Houston, Texas, H-Town, Qatar, San Mateo, Vancouver, Philippines, South London, the Bronx, Georgia, Connecticut, Japan. Oh, I would love to be Japan right now. Cameroon, Arkansas, Tanzania, Haiti, Puerto Rico, Spain, Arizona. People from all over. I feel like we have a lot of international people on right now, which thank you so much for joining in. I hope you're learning something cardiac related. And if not, I hope you're getting more practice watching us today. So, correct answer for this one is option 1. I am not at risk for developing a new DVT because I have had a DVT in the past. So, going back to the question, we're looking for statements that would require follow-up, meaning that they are incorrect statements, meaning something is wrong about the statement. So we know with DVTs, if you had one before, it actually increases your chance to getting another one and having it more frequently. So these clients actually are going to be put on anticoagulation medication forever, because once you have it once, it kind of ruins your streak record, and you got to be on the watch out for them for the rest of your life. So that is the incorrect statement that would require follow-up. All the other options are correct statements or correct teaching points, or correct teaching that the client is giving back to us. So this is the teach back. So option 2, I will plan rest stops during car rides to get out of the car and walk around. This is a good teaching habit because they can walk around and get that blood circulating instead of having that venous stasis being in that sitting position in the car. Option 3, I should wear compression stockings on days when I'm working long hours. This is also correct and something that us nurses do even as well, because those compression stockings kind of help those valves on the distal part of your legs to help pump the blood back up to the body. And then option 4, I will notify my healthcare provider if one of my legs looks larger than the others. This is correct because that is showing the signs of a DVT, so we need to do further follow-up and further evaluation with the healthcare provider. So that one seems pretty easy. So it says I just got here, what is a DVT? A DVT is a deep venous thrombosis, so basically a blood clot. Okay, question 6. So the nurse in the emergency department is caring for assigned clients. Which of the following clients should the nurse assess first? So think high priorities, think ABCs, airway, breathing, circulation, and then the nursing process. Option 1, a 32-year-old client who has right lower quadrant abdominal pain and rebound tenderness. Option 2, 54-year-old client who has severe back pain and a pulsatile mass in the periumbilical area. Option 3, 75-year-old client who has fever, nausea, and left lower quadrant abdominal pain. Or option 4, an 87-year-old client who has confusion, suprapubic pain, and dysuria. Let me know what you guys think in the chat. Good job, guys. And when you put your answer in, maybe give me a rationale of why you think that answer is correct. What is that possible complication that you might be thinking of? Good job, Abisola. Good job, guys. Seeing some correct rationales. You are correct, Fizzy Bomb. Good job, guys. Also, let me know in the chat, what topics would you like us to cover? And I know you guys are going to say pharm and peds. I know. We actually will be having pharm and peds in the next, I would say, like 2 weeks. So we got that covered. What other topics would you guys want us to cover in the next couple of weeks? Drop them down below, and we will try to get that in our rotation very soon. I already see some pediatric. We'll have that. And maternity. Pediatric, maternity, and pharm is coming up in the next 2 weeks. Diabetes, mental health, that's a good one. Psych, med-surg, psych, EKG, mental health. We'll have Samantha take note of these. Option 2 is our correct answer. That 54-year-old client who has severe back pain and a pulsatile mass in the periumbilical cord. So that key word there, or the key word that we're looking for that's making it a red flag, is that pulsatile mass in the periumbilical area. So this is indicative of that AAA, the abdominal aortic aneurysm, which is a blood-filled bulge in the abdominal area, and that's caused by the weakened blood vessel wall and increased pressure. So think of like the layers of the vessel wall just thinning out, and it creates that almost like hernia, and it's with your huge vascular system. So if you have any type of puncture or any type of pressure that kind of ruins that already weakened vessel wall, we could have a bad medical emergency with a hypovolemic shock if that ends up rupturing. So this is a very big medical emergency, and this is the client that we need to assess first to prevent life-threatening complications from happening. Option 1, some of you guys got this right. The 32-year-old with right lower quadrant pain. This is showing signs of appendicitis. It is a priority because we need to make sure that the appendix also doesn't rupture, but that AAA is a higher priority because that aorta is such a big blood vessel that you can very quickly bleed out. So we need to assess that one first. That would probably be the second client. Option 3, 75-year-old client who has fever, nausea, and left lower quadrant pain. This is showing signs of diverticulitis. something that we can treat with antibiotics and keeping them NPO, not a medical emergency at this point. And then option 4, 87-year-old client who has confusion, suprapubic pain, and dysuria. This is indicative of a UTI. Again, not a higher priority than the ABCs of option 2. But you guys did very, very good. Question 7, the nurse is reviewing new medication prescriptions for a client who's receiving clopidogrel. The nurse should clarify the prescription for what? So we're looking for a drug interaction here. Are we clarifying option 1, metoprolol, option 2, furosemide, option 3, omeprazole, or option 4, levothyroxine? Let me know what you guys think in the chat. Good job, guys. Oh, someone else says pharmacology. Pharmacology is also something that we will be covering in the next couple weeks. Just you wait. Good job, guys. I should let you guys know that we have multiple times that you can tune in to us live and get these free resources, but you could also sign up for our free 7-day trial on our page at uworldnursing.com, where you get the practice questions that are different than the ones that we go through every week. You get about 50 practice questions in that free 7-day trial to practice on your own, see if you're getting yourself ready in the right swing of things, and just get access to that UWorld product to see if this is it should be the study package that you would use for your NCLEX so you can pass on the first try. So visit us at uworldnursing.com to get all things UWorld Nursing and all things pass your NCLEX the very first time. Good job, guys. Not everyone, but most people got this question right. That is option 3, omeprazole, would be something that we should clarify, which means this is causing some type of drug interaction, meaning we do not want to give this medication with clopidogrel. So what is clopidogrel? Clopidogrel is a medication, an antiplatelet medication, so it prevents blood clots. Omeprazole is a proton pump inhibitor, and with these two together, that omeprazole kind of hinders the clopidogrel's action. And we know clopidogrel, or antiplatelet medication, that is a very high priority medication. So we really, really, really want that medication to do its job and its normal mechanism of action. So if we add that omeprazole into it, it reduces that, which means that we have an increased risk for those blood clots all over again, which we don't want to happen. So the best way to avoid that is to just not give omeprazole and maybe give a different type of GI medication to prevent ulcers. So options 1, 2, and 4 would be not correct, or okay medications to still give with clopidogrel, and is very commonly seen given with clopidogrel. But omeprazole is the one medication that we cannot give with clopidogrel. But you guys did very good. Next question. The nurse is caring for a client with newly diagnosed atrial fibrillation. Which of the following actions should the nurse take? Option 1, prepare the client for immediate cardiac defibrillation. Option 2, instruct the client to bear down using the abdominal muscles. Option 3, teach the client about the need for long-term anticoagulation therapy. Or option 4, monitor the client's laboratory test results for an increased serum TSH level. Let me know what you guys think in the chat. Someone was asking, omeprazole is an antiplatelet? No, omeprazole is a PPI, a proton pump inhibitor. Clopidogrel is an antiplatelet medication. Good job, guys. So a glimpse into next week with more details. Next week we have a lecture about heart failure on Tuesday. On Wednesday, we have a GI question drill, and Thursday, we have another most missed question drill. So a lot of the questions that we commonly have students miss or answer incorrectly, to get that good practice to try to figure out those topics versus or those keywords to kind of get them the right answer. So most missed questions, GI question drill, and a heart failure lecture all next week. You could also go to our page at uworldnursing.com to see the next, I think it's 3 or 4 weeks out of the topics that we are covering on each day throughout the week. So visit us there. Someone asked, what times do we start? We are in Central Time, but we go live multiple times a day, multiple days of the week. On Tuesdays, we go live at noon Central Time. All of this is Central Time. Wednesdays, we go live at 11 a.m. and 7 p.m. Wednesday, we go live at 11 a.m. and 3 p.m. Friday, we go live at 7 p.m. Same with Sunday. And if I spoke too fast, you can visit us at uworldnursing.com to see those specific times in your area code. Correct answer for this one is option 3. Teach the client about the need for long-term anticoagulation therapy. So with atrial fibrillation, we know that the heart is creating that irregular rhythm, and that atrium quivering can cause venous stasis, which can cause blood clots to form and pool in that atrium. So we are going to teach the client that they are going to need long-term anticoagulation medication to prevent those blood clots from forming. So this would be a correct teaching point to be given. All the other options are kind of incorrect teaching points. Option 1, prepare the client for immediate cardiac defibrillation. We don't defib AFib, we defib defib, so that would be incorrect. We would actually do a cardio version instead if we really wanted to get them out of atrial fibrillation, but not defibrillation. Option 2, instruct the client to bear down using the abdominal muscles. This again is not used. That would be something that we could do for SVT or a super tachycardic rhythm, not necessarily for atrial fibrillation. And then option 4, monitor the client's laboratory test results for an increased serum TSH level. This is actually something that would be done for a bradycardic rhythm, usually a complication for hypothyroidism, not necessarily for atrial fibrillation. So the only correct teaching point for atrial fibrillation is that long-term anticoagulation therapy. Good job. Next question. The nurse is assessing a 54-year-old client during a routine physical examination. Which of the following findings would increase the client's risk for developing hypertension? Select all that apply. Option 1, has a first-degree relative with hypertension. Option 2, smokes 1 pack of cigarettes a day. Option 3, history of obstructive sleep apnea. Option 4, history of melanoma. Or option 5, BMI of 30 kgs. Let me know what you guys think in the chat. Basically, what are the risk factors for hypertension? Good job, guys. Lots of correct answer choices. While you guys are putting in your answers and thinking about that, let me know your school. What school are you representing? What nursing school do you go to? Let's do some shout outs in that way. So what nursing school programs or what school are you representing? Let's do some shout outs again. First one I see is FAMU. Fresno State alumni, well, thank you for watching. Davao Doctors College, Cambridge College, Barry University, UT Arlington, maps up, that's where I went to school. Oh, correct answer. University of Derby, University of Florida, Nightingale, UCLA, City Tech, St. Clair, Nova. I love seeing y'all school. Good job, guys. Chamberlain. Lots of Chamberlain people here. Just graduated from Simmons University, Penn State, and then there's a whole bunch of letters. Lots of letters universities. York University, Toronto, USC, Jinja. Anyways, Oh, okay. Correct risk factors for hypertension is almost all of them except for option 4. So we know risk factors is that first degree relative. It's in your DNA, it's in your genes to have high blood pressure. Option 2, smokes 1 pack of cigarettes a day. Smoking causes all the bad problems. So yes, smoking increases your chances of hypertension. Also makes your vessels very stiff. Option 3, history of obstructive sleep apnea. That's because of the obstructive and the vessels are hardening. And option 5, being overweight and having a BMI of 30 kgs. Option 4 is incorrect. Having cancer does not cause you to have high blood pressure. That is unrelated at all. Lots of schools in the chat. Love to see it. I'll do shout outs in a second. Last question of the day. The nurse is teaching a client who has a new mechanical heart valve and is taking warfarin. Which of the following information should the nurse include? Select all that apply. Option 1, request prophylactic antibiotics before any invasive dental procedure. Option 2, notify your healthcare provider if you develop flu-like symptoms. Option 3, take naproxen to relieve minor aches and pains. Option 4, schedule routine monitoring of your INR. Or option 5, avoid using an electric razor to shave. Congrats to Malwell Baby, passed their NCLEX. Congratulations to you. We have MSMU, Chamberlain, Chicago. They just graduated. Congratulations to you. Kingsborough College. Ergton University in Kenya, ENIP, I don't know what country that is, and lots of correct answer choices. Let me know how many questions out of 10. We did 10 questions today, guys. How many you got right? And also give us a follow if you haven't already. Like, comment, subscribe, share to all your nursing school friends. Try to get all your nursing school friends on at the same time so we can talk and interact with each other and maybe do some fun shout outs all together. So correct answers for this one, oops, wrong page, is options 1, 2, and 4. So we are looking for correct teaching points for a client who has a new mechanical heart valve. So that's one whole ordeal and topic. And then also taking warfarin. So 2 big things that we need to know. Warfarin, that anticoagulant, since they're having an artificial valve in their body, so we need to prevent any clots from forming or any clots from forming on that new valve. And then a new valve in particular, there's a lot of complications that we need to be looking out for, which is option 1, request prophylactic antibiotics before any invasive dental procedure. Since they have a foreign object in them, we need to make sure that we protect that foreign object. So we don't want any infection to happen. So for a significant time after the procedure, they're always going to be on antibiotics prophylactically before any other procedures, so we can make sure that that new heart valve does not get infected. So prophylactic antibiotics, especially for a dental procedure, because our mouth can hold a lot of bacteria and that could easily get into our bloodstream. That would be a very good teaching point to do. Option 2, notify your healthcare providers if you develop flu-like symptoms. Again, a correct teaching point because those flu-like symptoms could be indicative of infectious endocarditis, which is a heart infection. And with that new heart valve, that can streamline into going into more complications. So flu-like symptoms, we need to get into the doctor's office and get on antibiotics, preferably IV antibiotics, so it works quicker as soon as possible. And then option 4, schedule routine monitoring of your INR. This is just something that we always do when the client is on warfarin, because that warfarin has that narrow therapeutic level. So we try to make sure that we stay within that level and that range, usually between 2 and 3. So that's frequent monitoring of that INR level. Option 3 is incorrect because we actually don't give NSAIDs with warfarin. Those are contraindicated with warfarin. And then option 5, that was a little tricky because we don't want to avoid using an electric razor. We actually encourage them to use an electric razor because that is safer. So we want them to use that electric razor. But you guys did very, very good. Y'all did very well throughout today, and I'm so glad you guys joined in. If not, we will post this on our page in a few minutes for you to always reference a little bit later, or if you want to go back and see any of our other past question drills or lectures, they are posted on all our social media platforms, so you can tune in there. But until next time, I'll see you guys next week.